Hi, my name's Paul Grayburn. I'm a cardiologist in Dallas, Texas at Baylor University Medical Center. And I'm here to explain to you why contrast ultrasound is valuable. One very important aspect of using a contrast agent during cardiac ultrasound is that about 20% of patients don't make good enough pictures to make an accurate diagnosis in general. And even more than that, or even more patients than that have poor quality echocardiograms when we do a stress echo. So giving contrast is a simple way to improve the accuracy of diagnostic testing, both for resting echo and for stress echo. Now, in particular with regard to resting echo, there are patients in the intensive care unit who are often on a ventilator, laying flat on their back, and their echo images can often be very difficult, even in up to half of those patients. And in those settings, where the patient is already very sick, it's very important to make an accurate diagnosis. And in those settings, we find that contrast often changes the diagnosis and results in changing the therapy from something that may have been completely incorrect to something that may be life-saving in those particular patients. There are other uses of contrast that are really helpful. One is in identifying clot inside the heart, which of course can cause a stroke if it comes out. So it's very important to know that it's there and to give the appropriate medications to get rid of it. Another indication is something called a left ventricular pseudoaneurysm, which is a complication of a heart attack that has to be treated surgically. It's often fatal, and if not recognized promptly, can lead to the death of a patient. Well, it turns out that contrast is accurate about 75% of the time in making that diagnosis when a regular echocardiogram would miss it altogether. So in my practice, we find that contrast is useful because it saves patients' lives. It saves lives by making the right diagnosis, by keeping us from making a wrong diagnosis, and therefore allowing us to give the appropriate therapy in a timely manner.
Is it safe?
You know, a question has come up as to whether these agents are safe. And as many people have heard, it's been in the newspaper, the FDA put something called a black box warning on contrast agents. And this was done back in 2008 because of a report of a few patients that died shortly after getting a contrast agent. Since that time, we've gone back and looked at those cases and found out that the death was not caused by the contrast agent itself, but by the underlying disease that the patients had. And furthermore, a number of studies now in over 200,000 patients have shown that these agents are in fact safe. So we think that the black box warning is not justified and that the FDA should remove it, because unfortunately that black box warning has caused some physicians to be reluctant to use contrast agents, and that's detrimental to their patients.
What happens to patients who don't receive a contrast agent when indicated?
Well, of course, in many cases, contrast isn't needed because the echo images are beautiful, the diagnosis is clear. But if the images aren't clear and a contrast agent is not given, then the patient may be given a wrong diagnosis and therefore wrong treatment. Or an important diagnosis like left ventricular pseudoaneurysm or left ventricular thrombus may be missed, and the patient might not get the right treatment for that.
Downstream testing?
We think that you know, one of the biggest questions about contrast that's becoming more and more important as we learn more and more about the adverse effects of radiation is that if you give a contrast agent with echo, you may be able to avoid doing nuclear testing, CT, or other tests that use ionizing radiation, because we're now learning that ionizing radiation may cause a substantial number of cancers in patients in the United States. And as for me personally, I would just rather not have a test that involves ionizing radiation if I could have the same diagnosis made by a safe test like ultrasound with a contrast agent.
Cost?
Cost. I think that one has to always consider cost in the context of other things that might be done. So if a contrast agent is used, it typically costs a little less than $100. But if that saves you from having a $500 nuclear test down the road, it's very cost effective. I think the other point is that contrast agents with ultrasound can be used at the bedside in a very ill patient, and the diagnosis can therefore be made promptly and treatment initiated promptly, whereas some of the more expensive tests have to require the patient to be moved to another place, another facility, down to the radiology department, and there's a concomitant delay in the diagnosis and therefore the initiation of appropriate therapy.
What's it like for the patient to get a contrast agent? What's the experience?
Most patients feel nothing when the contrast agent is administered. It's given through an IV. It doesn't usually cause any burning, any sensation in the vein, so most patients are totally unaware of it. However, in a small percentage of patients, they may feel flank pain, they may get a headache, there may be some mild side effect, and in some patients there can be a reaction to it that looks very much like an allergic reaction. That seems to happen in about 1 out of 10,000 patients, so it's rare, and physicians who administer contrast agents are aware of it and ready to treat it if it were to happen.
And how does that compare to reactions to contrast agents used in other imaging modalities?
And the incidence of an anaphylactoid or what looks like an allergic reaction to contrast agents is very similar to the reaction of any injectable agent that we give, either for therapy or for other diagnostic imaging procedures. One advantage of the ultrasound contrast is it doesn't contain iodine or gadolinium, so it doesn't cause kidney injury or renal toxicity.
Anything else that you think should be said on the website?
They use this technology in other countries all over the world. Are we slow to get there?
Yeah, I think one of the things that's important to say about contrast is that there are some future applications of it that aren't ready for prime time yet, but really offer some great potential. So we've already got data coming out that these microbubble contrast agents can be used to help dissolve clots in the setting of a stroke or a heart attack, and that could become a very important therapeutic maneuver. In addition to that, genes can be put on these bubbles and used to deliver to specific organs to promote gene therapy. So most of that work right now is being done in animal models, but it looks very promising for future therapies because ultrasound can be used to target these microbubbles to specific organs, delivering genes to either cause growth of new tissue that needs to grow, say in the setting of diabetes, or conversely, to eliminate tissue that shouldn't be there, like cancer therapy. I think it is true that we're a little bit behind Europe and other parts of the world in the use of contrast agents. Some of this is regulatory, because the FDA is much more conservative about approving agents than in other countries. So some of these contrast agents in Europe are being used to image liver cancer and distinguish it from benign lesions in the liver. Same for prostate cancer imaging, for diseases of the kidney, and of course the heart, as I've already mentioned. I think it's a shame that some of the agents that are even invented and first used in America get to be used clinically in other countries before we have access to them here. That's unfortunate.
And isn't it just a matter of moving the transducer? There's nothing else really that's going on.
Well, I mean, not necessarily, because you wouldn't necessarily move the transducer from the heart, say, to the liver unless you thought there was a problem.
But let's say
you could do that in theory.
Yeah.
If you inject the agent, you could in theory do a head-to-toe scan, but the reimbursement is sort of, the way it's done is a doctor orders a cardiac scan, because the patient's having chest pain, and then you would look at their kidneys or something.
I thought Stephanie did it. Yeah. Not
about the way this works is if it's approved for the heart, once it's approved and you can buy it, doctors will use it for non-approved indications, and that's true of all kinds of drugs. So it's not necessarily true that the FDA needs to approve a contrast agent for, let's say, liver imaging. If the contrast agent is approved and on the market, a doctor who thinks he needs it for that can certainly use it. It's called off-label use, and it happens all the time with all kinds of drugs and all kinds of imaging agents.
But is it reimbursed if it's off-label?
Well, an example that where it is, yes. I mean, I would say it depends, but a great example of that is dobutamine for stress echo. Dobutamine is not approved for stress echo. We get reimbursed for dobutamine stress echoes, and we do them all the time.